Do you have any instructions for your patients about maintaining the new crowns in terms of, particularly this case, minimising further gingival recession?
Because Susie's brushing technique is quite good, and the gingival recession was not as a result of toothbrushing trauma, so I wasn't too concerned about brushing technique or what she uses for that matter. I think it will be just good standard oral hygiene care and maintenance with her general dentist.
And for this patient and patients in general, how do you go about managing damaging forces, for example, bruxism?
For Susie's case, or for any case, before we start treatment, at the very first initial consultation assessment, we spend a long time assessing their mouths for areas of concerns of parafunction. In Susie's particular case, every sign leads to a minimal severity or a minimal presence of parafunction. So hence in her case, I did not see the benefit of using an occlusal splint. However, for other patients where we could see, say, moderate severe generalized occlusal attrition, brachyfacial, jaw type, group function, or a history of cracked teeth, porcelain chipping, failed restorations, or even teeth fractures, then obviously when you can diagnose that they have a pre-existing medium or even a severe degree of parafunction, then definitely I think a prescription or a management of that parafunction, whether it's a daytime parafunction or a nighttime parafunction, is paramount before you start the case.
How long do you think it might be before Susie faces a similar aesthetic problem in terms of further gingival recession?
I really wish I have a crystal ball to be able to give every patient an accurate outcome prediction. Look, given Susie, in Susie's history, she recalled at about the 13th, 14th year into treatment when she's noticed some gingival recession. I expect it's going to be at least 10 years before she would notice any gingival recession, particularly when I was using the double cord technique, that I was able to apicalize the gingival margin before I did the crown preparation and really hide those crown margins in the intrasulcular space by somewhere around 1.2 to up to 2 millimeters for tooth number 21. I think it's going to be some years before that recession is going to be in place to reveal even more tooth structure.
And what kind of follow-up will Susie need in this case with either yourself or with her regular dentist?
Because this is a conventional PFM restoration, I suspect just routine, whether 6 monthly or 12 monthly checkup and cleans will be more than sufficient, especially her oral hygiene is good.
Well, Ben, it looks like a beautiful outcome for the patient. So congratulations to you and your ceramist on some wonderful work, and thanks very much for taking the time to talk us through the treatment and helping us to refine our skills in anterior crowns.
Well, thank you so much for having me, Peter. I've always been very much blessed and being supported by the profession and the colleagues, so sharing with the profession of what I've learned over the years is the minimum that I can do. Thank you again for having me.
Thank you.